Essential Children's Health Tips, Preventing HIV, AIDS. Welcome to our channel dedicated to children's health and well-being. While HIV, AIDS is often associated with adults, children are also at risk of contracting the virus, whether through vertical transmission from infected mothers or other means. In this video, we'll discuss practical tips and strategies to help parents and caregivers protect their children from HIV, AIDS. From education and communication to access to healthcare, join us as we explore effective ways to safeguard your child's health and prevent the transmission of HIV. Let's empower ourselves with knowledge and take proactive steps to ensure our children lead healthy and fulfilling lives. Let's begin. Hello, everyone. Today, we're addressing a critical health topic: preventing HIV, AIDS in children. While it may be a sensitive subject, it's crucial to discuss ways to protect our children from this virus. Let's dive into some essential tips to ensure our children stay healthy and HIV-free. Segment 1. Understanding HIV, AIDS. Explanation of HIV, human immunodeficiency virus, as a virus that attacks the immune system, leading to AIDS, acquired immunodeficiency syndrome. Overview of how HIV is transmitted, including through unprotected sexual contact, contaminated blood, and from mother to child during pregnancy, childbirth, or breastfeeding. Discussion on the importance of early diagnosis and treatment for HIV to prevent progression to AIDS. Segment 2. Open communication and education. Creating an open and supportive environment for discussing HIV, AIDS with children, using age-appropriate language and concepts. Providing accurate and comprehensive information about HIV transmission, prevention, and treatment. Empowering children with knowledge and skills to make informed decisions about their sexual health and well-being. Segment 3. Safe sex education. Educating adolescents about the importance of practicing safe sex to prevent HIV transmission and other sexually transmitted infections, STIs. Promoting the use of condoms consistently and correctly during sexual activity to reduce the risk of HIV infection. Encouraging open dialogue about sexual health and encouraging adolescents to seek guidance from trusted adults or healthcare providers. Segment 4. Prevention of mother-to-child transmission, PMTCT. Ensuring access to prenatal care and HIV testing for pregnant women to identify HIV-positive mothers early in pregnancy. Providing antiretroviral therapy, ART, to HIV-positive pregnant women to prevent mother-to-child transmission during pregnancy, childbirth, and breastfeeding. Supporting breastfeeding mothers with HIV by providing ART and counseling to reduce the risk of HIV transmission to their infants. Segment 5. Blood safety. Advocating for safe blood transfusion practices and blood screening to prevent HIV transmission through contaminated blood products. Educating children and caregivers about the importance of avoiding unscreened blood products and practicing proper wound care to prevent bloodborne infections. Segment 6. Access to healthcare and support services. Ensuring children have access to comprehensive healthcare services, including HIV testing, counseling, and treatment. Providing support services for HIV-positive children and their families, including psychosocial support, nutritional assistance, and adherence support for ART. Advocating for policies and programs that promote access to HIV prevention, treatment, and support services for children and families affected by HIV, AIDS. Segment 7. Stigma reduction and empowerment. Challenging stigma and discrimination associated with HIV, AIDS through education, advocacy, and community engagement. Promoting empathy, acceptance, and support for individuals living with HIV, AIDS and their families. Empowering children and families affected by HIV, AIDS to advocate for their rights, access healthcare services, and live full and meaningful lives. Thank you for joining us as we explored essential tips for preventing HIV, AIDS in children. By following these proactive measures and fostering open communication, we can protect our children from HIV and promote their health and well-being. Remember, knowledge is power, and together, we can create a world where every child can grow up healthy and HIV-free. Don't forget to like, share, and subscribe for more valuable content on children's health. Until next time, stay safe and healthy.